Lucy, John, Tom and Binesh are planning healthcare research projects. They know that patient and public involvement, also known as PPI, has a positive effect on research quality and end results. They want to hear views from PPI on their research topics and planned methods, but are not sure how and where to find the right people. Lucy decided to approach an existing patient support group in her local community relating to her research topic. She thinks that patients in the group will know a lot about their health condition and can help her to identify gaps in her knowledge. Lucy searches online for the relevant patient support groups and contacts the group leads for help. She briefly explains her research topic in an email and asks to meet the groups to discuss her proposed project. Lucy is able to meet them in their own setting to ensure comfort. Participants are likely to be familiar with each other, so they may be more willing to share their experiences. They may not require reimbursement for travel expenses or time. It may be difficult to find a patient support group that relates to her research topic. Lucy needed to have good facilitation and note-taking skills to record the discussion. She also needed to be flexible when arranging meeting times and dates. John was not able to find a local patient support group like Lucy and decided to form a new PPI advisory group. He wanted to find people that had experience in the topic he's researching so they could provide valuable PPI insight. He created a recruitment flyer and advertised it via email to existing PPI groups at the university, local hospitals and GP practices. John could also post it on social media or advertise it via third sector organisations like charities. Interested people then contacted John for more information. PPI members became part of the research team, met regularly and were invested in John's project. John could also measure the impact of PPI and found it easy to provide feedback to group members. John needed funding for travel expenses, venue, refreshments and PPI reimbursement. It took time to form the group and organise the meetings. John also needed to think about training for the group members. Tom works at the local hospital trust and decided to access an existing PPI group at the hospital. His aim was to gather their opinions to help him to define his research question. Tom had to gain a local trust approval and with the help of the trust's research and development team was able to share a flyer with existing hospital PPI members. Panel members were experienced in research and familiar with the PPI role. Tom also didn't need to get funds for meeting venue or expenses as this has already been covered by the Trust. This approach was for staff members at the Trust. Tom had to work closely with the Trust's research coordinator, which may add additional time to the process. Binesh wants to form a group specifically to review online documents like surveys. Like John, Binesh created a recruitment flyer and shared it with various groups. Members needed to have computer access to communicate electronically as there was no face-to-face meeting. No funding was required for meeting venue and refreshments. Binesh found that she was able to engage with hard-to-reach individuals such as housebound patients. This was an anonymous process which she believed encouraged PPI members to express honest views. Binesh's prepared documents needed to be compatible with various devices and software packages. There was limited opportunity to correct any misunderstandings as all communication was via email. She also felt that this approach excluded people who couldn't use digital technology. All four found that engaging with PPI had a positive effect on their project's progression and their own personal development. Lucy, John, Tom and Binesh would encourage all researchers to work with PPI.